I am happy to introduce you to Christine Billings, who leads Jeffco Public Health's Office of Pandemic Response. Christine will give us an update on the current situation regarding COVID-19. Christine?
Thank you, Commissioner Dahlkemper. As we continue to live with COVID-19 in our community, I wanted to take a moment to share with you an update on our current situation and the county's response, as well as a look ahead to what we can all expect in the coming months. I will start off by providing a brief update on COVID-19 in Jefferson County. As of December 16th at 4:30 p.m., we have had a total of 26,700 positive cases of COVID-19 in Jefferson County. Unfortunately, we have also seen 592 of our residents die from this disease, as well as 1,484 become hospitalized. For the 2-week period from December 2nd through December 15th, we had a total of 4,862 cases in the county, or a rate of 833.8 cases per every 100,000 residents. We also have seen a positivity rate for that same period at 9.7%, so right below 10%. In addition, our hospitals are currently reporting that they are at about 72% of their capacity of staffed ICU beds. And for our 7-county metro area, we are at a rate of about 70% of those staffed ICU beds. The reason all these numbers are so important is not only do they represent the individuals and lives directly impacted by this virus in our county, but they also represent the indicators that the Colorado Department of Public Health and Environment uses to determine Jefferson County's place on the COVID-19 dial. Jefferson County was moved to level red on the state's dial framework on November 20th by the CDPHE. We do not anticipate a move up or down on the dial from level red quite yet. Though our metrics are not all currently meeting the level red indicators, for example, we have begun to see a decline in hospitalizations. In order to move to a less restrictive level, we have to meet and sustain all of those metrics for 2 weeks. And then we can begin the process of consulting with CDPHE. We are watching our numbers closely, as well as the trends and potential spikes around the holidays, and we'll continue to update our community as the situation progresses. Another priority area for us is community testing. This month, Jefferson County Public Health worked with the Colorado Department of Public Health and Environment and Curative Testing to open a new test site at the Jefferson County Fairgrounds, and an even more exciting, almost mobile testing site that travels to our mountain communities in and near Jeffco, including one in Conifer and one in Evergreen. Since these sites opened in mid-November, and as of yesterday, we've had 11,900 tests administered at the fairgrounds, 388 tests administered in Conifer, and 500 tests administered in Evergreen. Test results are coming to our residents within 3 to 4 days, and we have worked closely with the state and Curative to make sure that these testing sites are running as smoothly and as safely as possible. We know this has certainly been a long road to get to this point with so many changes, and we are grateful to our community for your flexibility and resilience.
All right, thank you for that update, Christine. Let's go ahead and take some questions. As a reminder, you can participate in the discussion and ask a question by pressing *3 on your telephone. You will be transferred to an operator who will take down some basic information and get you in the queue. So *3 on your phone to ask a question. Let's take our first question from Eugene. Go ahead. Eugene, you are live. Go ahead with your question.
Oh, how I didn't realize that. I'm a physician. I'm wanting to know whether any allergy at all should lead you not to want to use the Pfizer vaccine. My understanding is that there were some anaphylaxis reaction in England, and someone had said at one point that if you have had any allergic reaction, not just to vaccines, but to foods as well, that you should avoid that vaccine. So that would be my question. To then try to use the Moderna instead of the Pfizer.
Thank you, Eugene. This is Dr. Mark Johnson. That's a good question, and a lot of people are concerned about the allergies. You are correct that there were several or a couple in England that had severe allergic reactions to the Pfizer shot. There was a report today also that there were one or two in Alaska that have had a severe reaction to the shot. The advice still is that those only who have had severe reactions to vaccines in the past need to be particularly worried about this. However, as a physician, you know, and I would agree that anybody who has had a lot of allergies should be at least a bit concerned and should let their healthcare giver know that they have allergies when they get the shot. I would not say that this contraindicates the shot, that they still should get the shot, and if Pfizer is the one that's available, that's the one they should get. But they should at least alert the healthcare giver to the fact that they have had allergies and allergic reactions, particularly if they've had anaphylaxis in the past, so that they can be watched particularly careful, that epinephrine and Benadryl and other things can be right there ready so that if there is any reaction that they can be cared for. But at this point, only those who have had severe reactions to immunizations in the past are the ones that have been targeted for particular care and concern over the Pfizer vaccine. Good question, Eugene. Thank you.
All right, let's go to our next question from Margaret. Margaret, go right ahead.
Well, I'm 69 years old, and I'm really concerned about, having a reaction. And I also have allergies. And anyway, done.
Christine?
Hi, this is.
Hello.
Hi, Margaret. This is. Hello. Hi, Margaret.
Yes, I have.
Hi, this is,
Yes. Go ahead.
Yeah, I thank you for your question. It's a really good question. You're really asking about the side effects of the vaccine, and the COVID-19 vaccines are subject to the same safety standards as other vaccine trials. So the side effects may differ among COVID-19 vaccines, but they are mostly commonly reported as the same as most other vaccines, such as a mild fever, chills, body aches, pain and redness at the injection site, maybe a little nausea, maybe a slight headache and fatigue. For most, these only lasted 1 to 2 days after receiving the vaccine, and it's indicating how much your body is building up the immune response. So you can get more information on vaccines on our website at www.jeffco.us/COVID-vaccine.
All right. We'll repeat that email address here again in a few minutes. Let's go to Patty next with a question. Patty, go ahead.
Yes, I'm Patty from Golden, and I would like to know the number of cases who have developed Bell's palsy from the Pfizer vaccine as a side effect. And is that from the first round of vaccines?
Hi, Patty. This is Margaret Huffman again. And
Yes.
I understand that there is some concern that has been put into media about Bell's palsy. When we track vaccines and the reactions through our vaccine adverse event reaction signal tracking system, we have not noted that Bell's palsy is a reaction of the vaccine. When people report certain reactions when they receive a vaccine, it all gets put into a database, And then it gets sorted through later on to see what might actually be caused by a vaccine and what may actually be coincidental. The cases of Bell's palsy were not found in the vaccine recipients, but could be found in the people who received the placebo. So it is not necessarily a result of the vaccine. It is potentially just a coincidence that happened at the same time that someone received a vaccine. I hope that helps.
Thank you, Doctor. All right, really great questions to start us off. Again, if you'd like to get in the queue to ask a question, please press *3. At this point, I'd like to turn it over to Commissioner Casey Tye to let us all know how we can stay vigilant and work together during this new phase of this response. Commissioner Tye, go ahead.
Well, thank you, Roger. And I am very excited to hear the conversation about a vaccine and the promise that a vaccine will have to let us reopen and get back to normal. But in the meantime, we need to stay vigilant. You know, we're close to the finish line here, but we aren't there yet. So everyone needs to remember during this holiday season that they've just got to follow those standard practices we've been talking about for so long. You know, people need to remember to wear masks when they're out in public and when they can't social distance. They need to try to social distance whenever they can. They need to wash their hands. They need to try to not congregate in large groups and just, you know, celebrate the holiday season with the family that they normally live with. We know it's hard. It's been a difficult year, but Jeffco, you've done really well so far. We're seeing that our infections start to go down after a little bit of a spike after the Thanksgiving holiday. So let's just finish strong, Jeffco, and continue to practice those great practices we've been doing to keep everybody safe. And now I'd like to turn it over to Dr. Johnson to talk a little bit more about what's going on with the vaccine.
Thank you, Commissioner Tye. I appreciate that. As many of you have heard, and as many of the questions that have already been put online have shown, people know that the vaccine is here in Colorado and in Jefferson County. We've been talking about this since the beginning of the pandemic, and we are so excited and very hopeful about it, what it means both for our response and for the recovery from this pandemic. First of all, it's important to understand that there are multiple different vaccines against COVID-19 from different companies, but all basically do the same thing, and that is prepare your body to address with antibodies the virus if you become exposed to it. The two vaccines that we're seeing at this point are the Pfizer vaccine, which is in the state, and the Moderna vaccine, which was approved by the FDA for the emergency use authorization today and may actually be approved for shipment tonight or tomorrow. The first delivery of the vaccine in Colorado, which included 46,800 doses, was from Pfizer. Additional shipments, both from Pfizer and Moderna, are expected to continue throughout December, both to Colorado and into Jefferson County. Both of these vaccines require 2 doses, and it is vital that both doses are administered on time. The Pfizer vaccine requires 2 doses 21 days apart, and the Moderna vaccine requires the doses to be administered 28 days apart. That's one of the differences between these two vaccines. The vaccines are not interchangeable. If you get a Pfizer vaccine the first time, you need to get a Pfizer vaccine for the second shot. If you get a Moderna vaccine for the first shot, you need to get a Moderna vaccine for the second shot. When you get your first shot, you will get a card that tells you both the type of vaccine that you got and the date that you need to get your second immunization. Keep that card and keep that date, because we will also be getting the vaccine for the second dose reserved for those who have had the first dose, so that we can fill that vaccine schedule the way it is for both of these vaccinations. As I'm sure you realize, it takes a lot of time and to produce enough vaccine to vaccinate everybody in the country, and there is a prioritization plan in place to ensure that those with the highest levels of risk receive the vaccine first. There are essentially three phases, although the first phase is divided into 1A and 1B. The first phase is for healthcare workers. 1A is for those who have very close contact with people who are infected with COVID, those who are treating face-to-face on the front lines the COVID-19 patients. This is not just physicians and nurses. This also includes respiratory therapists, some who are in X-ray technicians, or even housekeepers, those kinds of individuals in a hospital setting who have close contact with COVID-19 patients. Additionally, in phase 1A, it is going to be given to those who live and work in long-term care facilities, because these are at high risk, and they will be in 1A. After they have received that, we will then move into phase 2. Phase 2 will again focus on higher risk individuals and essential care workers, those who are elevated risk for getting very sick or dying from COVID-19. This includes adults ages 65 and older, or those who have underlying health conditions that put them at higher risk. This phase will also include people who have direct interactions with the public as part of their jobs and are thus at higher risk, such as grocery store workers, school and child care workers, those who are in high density settings such as meat packing plants or in some farm jobs. That will be phase 2 of the vaccination. Phase 3 then will be all of the rest who are in the general public, those who are not included in one of the earlier phases. Some of the questions are asking, how do I get in line? Do I need a note from my doctor to make sure I get my shot? Some of those logistics are still being worked out at the state level and at the county level. And as soon as there is information on that, we will try to get that out to you. We expect that it will take several months until everyone can access the vaccine. And in the meantime, as Commissioner Tai already mentioned, we need our community to continue to follow those critical public health guidance prevention steps that we have talked about ever since last April or February, really. Prevention includes wearing your mask when you're in public, maintaining at least 6 feet physical distance from others, avoiding large crowds, washing your hands often, not gathering with those who are outside of your household, and staying home when you're sick. Even when you get the vaccination, it's important to continue these steps because there are some things we do not yet know about the vaccination. One of those is, even though it may protect you, if you do get the virus, you may still be able to spread it to others. That's something that's still being studied. So these prevention steps are extremely important even after you have received the vaccine. We're hearing that there are a number of questions about the safety of the vaccine. The FDA has gone through a rigorous scientific process to study these, including 3 phases of clinical trials, first on animals, then on a small number of individuals, then on a large group of individuals before they authorize or approve the vaccine. And the COVID-19 vaccines are subject to the same standards and trials that other vaccines have gone through. To date, the Independent Data and Safety Monitoring Board overseeing the phase 3 trials of the Pfizer and Moderna vaccines have not identified or reported any serious safety concerns. You've probably heard that there are some side effects such as mild fever, chills, body aches, pain and redness at the injection site, perhaps some nausea, headache, and fatigue. Most of those last only 1 or 2 days. And that is actually a good sign. It shows that your body is reacting to the vaccine, and it is reacting in a way that is now making antibodies. Jefferson County will continue to update the community with more information about the COVID-19 vaccine on our website. So please take down this website. It is www.jeffco.us/COVID-vaccine. I'll now send this back to Roger so we can take some more questions. Thank you.
All right. Thank you, Dr. Johnson. As a reminder, you can participate in the discussion by pressing *3 on your phone. You'll be transferred to an operator who will take down some information and get you in the queue. We have a lot of people in line, so I'm asking you to be very prompt on your question, and I'm asking our panelists to also be very, very prompt in answering so that we can get to as many questions as possible. Well, let's go next to Greg. Go ahead, Greg.
Mine is a two-part question. I believe I might have had it back in January. Can I get it? Will an antibody test go back that far? And where do I get an antibody test? Hello?
Thank you, Greg. This is Dr. Johnson again. That's a good question. As far as where you can get an antibody test, there are numerous places. You can call a testing site and ask them if they're doing antibody tests. Most many physician offices are doing antibody tests. Some hospitals and urgent care centers and other places are also providing antibody testing. The real question, though, is how long does antibodies last? And that's a question that we do not have a good answer for at this time. Some of those who we know have been infected early in the disease have had initial antibody tests or testing and have recently been tested again. In some of those, it shows that antibodies are strong up to 8 months in some individuals, and it probably depends on the individual and the viral load that you had if you did get sick. So it's impossible yet to tell exactly how long antibodies will last. It would be interesting for you to get an antibody test and see if you do have antibodies. But we do not yet know, and we do not yet know for sure how long the antibodies will last with the vaccine also. So that's a very interesting question, but unfortunately, we don't have a good answer to that yet. Thank you.
All right, William is next. William, go ahead.
Yeah, my question is, I'm 82, and I wondered what can I expect as far as getting in line to get a shot? What time frame?
Hi, William. This is Christine. So the governor and the American Academy of Immunization Practices has worked out sort of a tiered approach to delivery of the vaccine. And our community members who are age 65 and older are in phase 2, which we expect to be able to start to vaccinate in the spring. So I would guess sometime around the April timeframe is a really solid date to target.
Thank you.
All right, thank you. Let's go next to Kendra. You're with your question. Go ahead, Kendra. Oh, Kendra, we seem to have lost you. Let's go to Tony is next. Go ahead, Tony.
Yes, I just want to know how long the Jefferson County Fairgrounds testing site is going to be open, and is there a charge for the test?
Hi, Tony. This is Christine Billings again. Our fairgrounds site will be open at least through the end of March, and the test is absolutely free. The wait is super short, and the test results come back fast. So please head out there and get tested if you are feeling the need that would be the right choice for you.
All right. Ben, it's your turn. Go right ahead.
Hi, can you hear me? I'm wondering about what Jefferson County plans to do to help people with their utilities. I understand the need for the vaccine, and although I'm waiting to take it, I still don't think it's a bad thing. I just want to know what Jefferson County is going to do to help us with our utility payments. Thank you.
Hi, Ben. That's a great question. This is Mary Berg, and I'm the Human Services Director. And we have been providing a significant amount of support and resources to different community members who are in need. And we have a wonderful website that I can direct you to that is will provide
a number of different resources. And so that website is www.jeffco.us/2637. And we will continue to support our residents through the recovery and provide whatever assistance and support through our nonprofit partners as well. So thank you for that question.
Let's go to Denise for a question. Go ahead.
I'm wondering if you guys have any plans as far as the people who live with a person who is maybe immunosuppressed and they can't get the vaccine. My brother-in-law was just diagnosed with cancer, and he won't be able to get the vaccine, but he lives with my sister and his 4 kids. So that would put him at risk if they're not vaccinated, but they don't have any health conditions. Has that been discussed at all as far as that type of live-in situation?
Hi, Denise. This is Christine Billings. So our home health workers who work directly with patients are being prioritized into the phase 1B group. So workers in home health and hospice, dental settings, our EMS, firefighters, police. So the folks, the home health workers that are, providing that care in the home will be prioritized into the 1B area of the phases, which will likely be, this is all vaccine flow dependent, but our hope is that we will be launching into 1B probably within like the February timeframe. Again, all tentative based upon the amount of vaccine we receive, but I would say targeting 1B for those home health workers.
All right, lots of great questions. We'll get back to yours here just in a couple of minutes, but I would first like to call on Commissioner Libby Szabo to introduce our final panelist. Commissioner?
Well, good evening, everyone, and I just want to say thank you so much for being part of our telephone town hall tonight and taking some time out of your busy day to get on and hear all the hard work that's coming to fruition that Jefferson County has done. And so we know these are incredibly difficult times for everyone. Whether you're a parent trying to work from home and homeschool your child, or you're a senior in our community that hasn't been able to see their family in a while, or a business owner who is struggling to make ends meet, we know that these are all critical things in our community, and we want to help in any way we can. Like you heard from Mary Berg, there are resources, and we have heard from many organizations in this county of all the resources that are seeing higher numbers of people trying to access them, whether it's getting your utility bill paid for, or some type of housing voucher, or food banks. They are seeing an incredible amount of first-time folks coming to the food bank, and so they are working overtime to try to keep those stocked and trying to help our community. But I would like to introduce Dr. Margaret Huffman, the Director of Community Health Services at Jefferson County Public Health. She's going to be our final speaker tonight, and she's going to talk about the Calm Unity campaign from Jeffco and the resources available to the Jeffco residents. So, Dr. Huffman, why don't you take it away?
Thank you so much, Commissioner Szabo. And you hit the nail on the head. If the COVID-19 pandemic has shown us anything, it is how strong and resilient we are when we work together and lean on one another. Our community is full of important and robust resources, and they have been there for those who have needed them since the beginning of the pandemic. More people than ever need help, and we're seeing it more and more from those who have never had to ask for help before. It could be because of job loss, illness, isolation, or something else entirely. Our business community is in a similar position. Many of our small business owners are facing the hardest time they've had since they opened their doors. Because of all this, partners throughout Jefferson County, including Jefferson County Public Health, Human Services, Public Affairs, and many of those resource providers, come together to launch a new campaign called Community. This campaign is available in both English and Spanish, and is designed to help make sure that whoever needs help can find the resources available to them in our county. You can get all of the details on our website, so please make a note of this, and we'll make sure that we repeat this again, www.jeffco.us/community. As we mentioned, it's all available in Spanish too at www.jeffco.us/comunidad. As we head into the last stretch of 2020, we're facing a reality different than we have ever imagined. We have come together as a community to get to the other side of this crisis together and stronger. Ask for help when you need it. Give help when you can. And as always, remember that you can make a difference during this pandemic, both by stopping the spread of the virus and supporting our local economy. Local businesses in our community need you, and you can help them this holiday season by purchasing gift cards or ordering curbside, takeout, or delivery. And as always, remember those 3 W's. Wash your hands, wear your mask, and watch your distance. Stay at least 6 feet from others and avoid gatherings with those not in your household. That last part can be especially hard during the holidays. We all want to spend time with our loved ones during this special time of the year, but the safest way to celebrate is to keep it to those who live with you. Please avoid gatherings with people outside your immediate household, and remember, the sooner we slow the spread of COVID-19, the sooner we can get back to being able to be together with all of our loved ones for special moments like these. More tips for how to celebrate the holidays safely with COVID-19 in our lives are available at www.jeffco.us/coronavirus. With that, I'll turn it back to Roger so we can take some more questions.
All right, thank you, Dr. Huffman. One more reminder that you can participate in the discussion and ask a question by pressing *3 on your phone. You'll be transferred to an operator who will take down some basic information and get you in the queue. Again, we have a lot of people lined up, so please be brief when I call you. We're going to go next to Aaron. Go right ahead, sir.
Hello. So my question revolves around the vaccine. So what's the difference between emergency use authorization and 100% like typical standard FDA approval, and what's that timeline look like?
Hi, Aaron. This is Christine Billings, and I may lead on Dr. Huffman here a little bit as well. So an emergency use authorization is a tool that allows the use of what we call medical countermeasures, including vaccines during public health emergencies. So our COVID-19 pandemic is considered a public health emergency. And under that EUA, the FDA may allow the use of medical products that are either new and there's not enough data that they can say that it's approved, but they determine that it is very much safe and effective to be used to treat that virus that is causing that public health emergency. So in our case, Pfizer, which has that EUA for the vaccine, has submitted plenty of evidence and information to the FDA for them to determine that the vaccine is safe and effective. But they don't have the basically years of data that are needed to call it an approved. So the FDA will monitor the data as the vaccine goes out into the public. And once they reach a point where they are prepared, they will call it approved. I do not know the timeline. It is not a hard and fast deadline between an EUA and an approval, but know that they are hard at work with monitoring the data that is coming out of the vaccine, and they have determined that it's safe and effective, and they are pushing it out across the nation for all of us to receive the vaccines.
Okay, let's hear next from Jim. Go ahead, Jim.
Yes, this is a question for Dr. Johnson. Is it Jefferson County Public Health's position that if you've already had COVID and you tested with antibodies, that you should get the vaccine, or you should not get the vaccine, or should you take any other precautionary measures if you already had COVID other than getting the vaccine?
Thank you, Jim. This is Dr. Johnson. Jefferson County has not taken an official position on this, but it's an excellent question that comes up, particularly of those who have already had COVID. For the most part, the experts that I have spoken with and have read about, and I agree with them, is that if you have had COVID-19, unless it is just recent or unless you have had those monoclonal antibodies, it would still be wise for you to go ahead and have the vaccination. If nothing else, it acts as a booster and would help to boost your immunity, even if you already have the antibodies. Basically, that's why we have the two shots. One is to start things, the other is to boost it and to get you up to that 95% efficacy. And if you've already had it, getting the vaccine will not hurt you, it will not cause a problem, and it probably will just increase the amount of antibody and the length of antibodies that you have. So I would suggest strongly that you go ahead and get it, and that's what most of the experts that I have heard or talked to have also agreed with. Thank you, Jim. Excellent question.
All right, let's go to Rachel next. Go ahead.
Can you hear me?
You sure can. Go ahead.
So my question is, how are we going to get the vaccine out to, different populations, like maybe our homeless population, and how, where would, certain different, how can we get that to them?
Hi, Rachel. This is Christine Billings again. One of the awesome programs that we have stood up under the Office of Pandemic Response is a program called our Whole Community Inclusion Program. And through the effort of that program, we have established basically what we'll call community navigators and community ambassadors. And this team is hard at work interacting with all members of our community in priority populations, our homelessness population. We also have established a position that is very much directed at outreach to persons experiencing homelessness. So we are very much aware of the different and very hard to reach members of our community, and we are hard at work making sure that we have programs that can live on past the pandemic to address the needs of these communities through staying safe with testing, through vaccine, and then moving on through the recovery from our pandemic.
All right, let's hear next from Elizabeth. Go ahead.
Well, I just got to say I just have to say perfect timing, because I was just speaking with the supermarket attendant and literally just walked away. But my question is,
go ahead. Hello, Elizabeth?
I'm so sorry. My cheekbone muted my phone. It happens all the time. What % of the population needs to have the vaccine in order for the entire population to be considered okay? And is the vaccine mandatory? And in some cases, when is it mandatory?
This is Dr. Johnson. I'll address that question. Good question, Elizabeth. As far as is it mandatory, the government is not mandating it, but there may be some employers who mandate it. You may have heard that there are some hospital systems that mandate that their employees get vaccinated for influenza every year. They may decide that they're going to mandate it for employment at various places, healthcare places. Others may decide it. But as far as the government mandating it, that is There are no signs that that's going to happen, and I do not believe that will happen. As far as the percentage that need to be vaccinated to get to what we call herd immunity, that's an interesting question, and I don't want to get too technical, but sort of a quick and easy way to think about that is how many people does somebody who is infected with COVID pass that disease on to? That's called R naught for those of you who are epidemiologists. But if one person infects 2 people, then the R naught would be 2. If one person infects 15 people, like with measles, the R naught would be 15. And the way we sort of thumbnail decide or figure out what the herd immunity needs to be is to divide that number. If it's 2 people, we would divide that into 1 and subtract that from 1. So that would be 1 minus 1/2. We would say if one person infects 2 people, then probably 50% of the population, 1 minus 1/2, needs to have immunity for it to stop. If that is 20 people, like with measles, then it would be 1 minus 120, which would be 95%. With COVID, it's somewhere between 2 and 3 people that one person infects. And so the number that's being used is around 60%, 60 to 70% of the population probably needs to be immune for us to have herd immunity. And I hope I didn't get too technical for you.
Thank you, Dr. Johnson. Jeremy is next. Go right ahead.
Thanks for taking my question. I'm a Jefferson County Public Schools employee, and I was just wondering the time frame when that would be available to Jeffco Schools employees.
Hi, Jeremy. This is Christine Billings. First of all, thank you for being a hardworking Jeffco School employee. We appreciate your efforts for the students in our community. We anticipate, so our teachers, our school staff are in phase 2. So similar to our community member who was above the age of 65, our school staff will be included in that second phase of our vaccine delivery. So I am anticipating probably early April. Hopefully we get greater numbers of vaccine coming into our community and we can move that into March. But it is anticipated that April through May will be the vaccination efforts surrounding our school staff. We have had some questions come in over the week about students. So our vaccines that are available to us currently, the Pfizer vaccine, is not ready to be delivered into the pediatric population. There are a lot of nuances and a lot of data that is required before vaccines are approved in pediatric populations. So as far as the students in our schools, they are not in line and in the phases yet, but as the data comes in, the great thing about the phases is that they can be changed. And so as more data comes in and these vaccines get approved for different populations, we will be able to include that in that strategy. But as far as our school staff, I would target April.
All right, let's go to Jason next with a question. Go ahead.
Good evening. My question regards the Jefferson County and whether it's going to participate in the 5-star program that Mesa County has been experimenting with for the past few weeks to allow indoor dining to establishments that are able to meet the criterion.
Hi, Jason. This is Don Davis, the county manager. The plan that Mesa has been doing is something that the state looked at, and they came up with their version recently. We received a couple of days ago the 5-star program checklist that they would like to, or that they approved for the state. It shows that we are not, we did receive a report card today from CDPHE that also shows that we are not yet qualified to even implement the 5-star certification program. We've also received the requirements and guidance on how we can implement once we are qualified. But in the meantime, we're going to be working with our Jeffco business partners, chambers, municipalities to examine this program and its feasibility.
All righty, let's go to Mike next. Mike, go ahead.
That's me, this Mike.
I just want to say thank you to all of you for providing this very valuable asset to all of us out here trying to get information. My question is kind of morphed over hearing the previous conversation of I have tested positive for the antibodies. If it's recommended that I do go ahead and get the vaccine when it becomes available to me in phase 3, how are we then tracking the information of how long those antibodies are good if we're going to go ahead and get vaccinated anyway? Thanks.
Mike, this is Dr. Johnson, and I'll try to address that question. At this point, I am unaware of any studies that are being done for the general population tracking long-term antibodies. I'm sure somebody is doing it. I wouldn't be surprised if there's somebody at the University of Colorado or someone in Colorado who will be doing a study like that. I know that the vaccine producers will be studying to see how long the vaccine continues to have antibodies. I do not think the fact that you've had the disease and then have the shot is going to complicate that. It will just, if anything, it will just give you antibodies longer. But again, as I mentioned earlier, we don't know yet how long those antibodies last. There will be a lot of studies that will be looking at that. And having people who have had the disease and then had the vaccination will probably be a group that they will want to study and see if it does cause a longer period of antibodies. But at this point, I am unaware of anyone who is doing those studies. Good question, though. Thank you.
Thank you, Doctor. Linda, it's your turn. Go ahead.
Yes, and I was wondering, since it's been such a short time, and how are they able to tell about the possibility of the side effects with like infertility? As I read that there was actually the FDA had found 22 serious side effects and muscle weaknesses and just on and on. And I think infertility would be a very dangerous one for anyone that's still wanting to have children, and that's not long enough to have been tested yet. So how are we sure about that?
Linda, this is Dr. Johnson, and as I'm sure you're aware, in this country, there is a lot of controversy around vaccinations. This was before we had COVID, and this will continue after we have the vaccination for COVID. And there are people who will put information on the internet and social media that has not yet really been definitively proven. The FDA has looked carefully at the data that has been collected both by Moderna and by Pfizer for tens of thousands of individuals and have found very few serious side effects. In fact, with Moderna, there were no serious side effects that they had found. As I mentioned earlier, there are some side effects that just show that the body is making antibodies, things like mild fevers or chills, a body aches, some pains and aches and things like that. But they usually are gone within 1 or 2 days, and that is again a sign that your body has made antibodies. After the 3 phases that I mentioned, there is a 4th phase, and that is what we will be in now that the vaccine is out and is being given. That will be studying the millions of people now who get this and finding, are there any side effects that were missed in those tens of thousands, and are there any serious side effects? At this point, we do not believe that there will be. But there will be some who do have some very unusual either physiology or makeup of their own body or allergies that they have that may have side effects. Those will all be recorded. There is a federal program called the Vaccine Adverse Effect Registry or Response System that takes all of those side effects, reviews those, and then makes recommendations as we go through, seeing what happens with millions and millions of people. As far as the sterility, that we haven't even had a length of time yet to show something like that. So I do not put much stock in those kinds of reports that are being propagated at this time, that we will be able to follow the FDA studies over a period of time to see what happens in the long run. We believe at this time that there is no physiological reason to believe that there will be serious side effects, but that study will continue indefinitely to make sure that we haven't missed something. Thank you for your question.
Thank you. Lawrence is next. Go ahead, Lawrence.
Hi there, and thank you for doing this. I am a Kaiser patient, and I am a bit confused as to how this whole thing is going to work. Will I be getting the shot from Kaiser or from Walgreens or from somebody at Jefferson County? I just, I don't have any idea.
Thank you. That's a great question. It can be very confusing. You should be getting your vaccination through Kaiser. We believe at this time that most primary care physicians will have vaccines to immunize their own patients by Tier 2, so there's still more to come, but please check with Kaiser.
Carol is next. Carol, go ahead.
Hi. I was originally wondering if this is going to be, the vaccination is going to be needed on a yearly basis, but it sounds as though it's still unclear as to how long the vaccination antibodies will be. So is that somewhere in the plan as far as how often we'll need to have the vaccinations?
Carol, this is Dr. Johnson, and that again is an excellent question, but you basically answered it yourself. We do not yet know whether this will be like the flu vaccine where you need to get it every year or every other year or every 5 years. As you probably know, most vaccines have a periodicity that has been determined. Some you need to get every 10 years, some you only need to get once, and it's good for a lifetime. We do not yet know what the periodicity for this vaccine is going to be or how often it's going to be needed. So a good question, but we don't have an answer to that yet. Thank you.
Thank you, Dr. Mike. It's your turn. Go ahead.
Hi,
Mike, it's your. There you go.
Yep. My in-laws are 70 years old or over 70, and they have comorbidities. And I was wondering two things. One, I think has been answered. That is, where do we get the vaccination? It sounds like primary care physicians are going to be administering it, but they're at a very high risk of COVID. And I'm wondering, are they in the first? When will they be able to get the vaccine? That's my question. Can they? Will they be in an early group versus maybe a later group of eligible persons?
Again, this is Dr. Johnson. Good question, Mike. And from the way that we have put the phases together, they would be in phase 2, but I would encourage them to be early in phase 2 because they are elderly and they have comorbidities. They would be after the healthcare workers and those who are living in long-term care and the emergency response, those sorts of folks that are in phase 1, A and B, but they would be one of the high-risk folks in phase 2. They probably will not be, we're guessing that this will probably not be until sometime early in January or mid-January where we'll be getting into phase 2, but I would certainly strongly encourage them to speak with their healthcare provider and make sure that they're getting in the queue quickly once we get into phase 2. Thank you.
Thank you. Let's go to David next. David, go ahead with your question.
Hi. I'm 77 and I have comorbidity, and my question is, I guess, partly answered if my primary care physician will have the vaccine in early January. If not, do I have to provide evidence that indeed I've had the heart attacks and the chemotherapy?
David, this is Dr. Johnson again. We actually discussed this yesterday with a group of directors in public health and the state health department. That has not yet been determined exactly how folks are going to be how they're going to prove that they're in which category. With the first category, it's fairly easy that you can show your badge or you show that you know where you work. With the next, that has not yet been determined. I think that we would all like to be able to say, you know, if you tell us you're in a high risk and you've had those diseases, we'll put you in that. Unfortunately, there is some fear that people are not going to tell the truth, so we're still working on exactly how are we going to be able to do that. It may be that you need a note from your physician or your caregiver. That is still being determined, but hopefully we can have that information for you fairly rapidly so that you know how you can get into line quickly when you need it.
All right. Thank you, Doctor. Unfortunately, we have come to the end of our hour-long telephone town hall. Good questions. Dr. Johnson, do you have any closing remarks?
I do, Roger. Thank you very much. I want to reiterate what we have said several times through this, that we are so excited that we have a vaccine, that we're beginning to get people vaccinated, that this will hopefully lead to herd immunity within the next months, that we'll begin to be able to see the end of this pandemic. But I would also urge folks to remember we are not there yet. We are still at a point in time where we have extremely high rates of infection, extremely high rates of hospitalization, and high death rates. It is no time for us to get lax on our prevention activities. We need to make sure that we are continuing to wear our masks, that we're continuing to keep social distancing from those who are not within our own household, that we're washing our hands frequently, and doing all of the things that everybody has heard for months now. Having said that, I also would like to let folks know that there is a way of keeping up with what is going on by coming or going to our website for the latest information on COVID-19, the vaccine, as well as the latest news about what's going on in Jefferson County as far as the pandemic. That can be found on the website at www.jeffco.us/coronavirus. That will help keep you up to date both on the vaccination as well as what is happening with the spread of the disease in Jefferson County, and we hope that you take advantage of that to keep educated as to what's going on. Thank you very much.
All right. Thank you, Dr. Johnson. We are sorry if we did not get to your questions tonight, but you can still leave a message at the end of the call, so just stay on the line and you'll be directed to a voicemail system. If you would like a response, please be sure to include your email address or phone number. On behalf of Jefferson County Public Health and the Jefferson County Commissioners, thank you very much. Stay healthy and good night.